Okay, so this is the biomechanics. Now we're going to do this in two parts. The first part is going to be the actual lecture, which is going to talk to you about just basically pulling everything that we've learned so far together. And then the second part is going to be kind of more of a hands-on type thing, and we'll use Zoom to kind of do that together, and that'll be a little bit more. That'll be a separate type thing. So, but I want to talk a little bit about biomechanics with you, and really kind of stressing along the neuromuscular, functionality of the human body a little bit more. Okay. All right. So, learning objectives. So, biomechanics, it's the science concerned with the internal and external forces acting on the human body and the effects produced by these particular forces. Okay, so this can be associated with the muscles, can also be associated with any forces external, such as massage therapy, and how that is going to have an effect on the on the person's body. These are just some particular terms. I mean, you may have seen these in like a physics class or something: force, pressure, inertia. I'll be using a number of terms like this throughout the lecture. So this is just for your reference purposes. All right. So before I really begin in terms of talking about biomechanics, we have to talk a little bit about vectors in 3D space, and so these would be kind of the force vectors. And for 3D space, we have an X and Y axis, which you may be familiar with already, from algebra class. But then also we have a Z axis as well, okay, which gives us the three-dimensional aspects. And so we, when we're referencing forces onto the human body, we are going to be affecting the three-dimensional space. We're in three-dimensional space, so there's three directions of force that can be applied. To kind of simplify it a little bit, what I'm going to do is just kind of talk a little bit about just two of those vectors. Okay, so X and Y axis. So the vertical axis as well as kind of the horizontal type axis here, and this will kind of help in terms of how forces are applied to the human body. And so when a massage therapist is applying pressure or some sort of force to the human body, and as you can see here from the hand, there's an angle that is taking place here. All right, and I'm not gonna ask y'all any math questions, okay? But we're looking at this in terms of concepts here, okay? This pink arrow is representing the force from your hand going onto the client, and that force can be it can be broken up into two vectors, so a horizontal vector and a vertical vector, okay, in which you're sending force into the body, from these two particular vectors, in this case the horizontal and the vertical axes. All right, and depending on how you approach your massage therapy or your client, you can include both of these particular vectors or one. All right, and so this really kind of helps in terms of understanding, okay, how much force are you applying to the client here? And so if we're going uphill versus downhill, so and these are relative terms. So uphill, we're using the leg as an example here. If we're taking the palm and we're bringing our force downwards onto the leg here, we've got two force vectors. One's going down into the leg, and the other one's going outward. Okay, and so this downhill one, only the vertical force vector is producing any types of changes in the actual soft tissues here. Okay, versus if you're going uphill, up the leg. Here, both the vertical and the horizontal vectors are being applied into the client's tissues. Okay, now this can be beneficial, and this depends on the angle of where your hand is. And if you're not using your hand, it can also be, this could be your elbow, it could be, you know, your knee, or whatever other part you're using to do the body work. Now, one of the things that we have to talk about with biomechanics are just some basic principles of levers and fulcrums. And I think everybody kind of knows what a lever and a fulcrum is. And so the lever, which would be kind of the green bar here, is going to be balancing a mass. It's going to be balancing a mass that rotates around a fixed point called a fulcrum. Okay, and so we have the load here, or the resistance, on one end, and then we have the effort, or what you're going to be doing, on the other end. And so there's three different levers that we're going to talk about. So the first fulcrum, first class lever, is what you would normally expect. Okay, it's like a seesaw. All right, you have the load located on one side of the bar of the lever, and then you have the effort on the other side of the bar. Okay, you push down on the effort here, the load goes up. If you release the effort here, the load goes down. Okay, you can see the scissors here, gives a good example of a first class lever. How do you apply that in terms of the human body? Well, you can use the atlanto-occipital joint as the fulcrum, as a focal point here in the base of the skull, and the jaw as the lever, and the load in this case would be the weight of the jaw pulling down, and then the effort would be the sternocleidomastoid contracting here. And so that way you're able to raise the head, extend the head if the muscle contracts, or in this case, if you relax that muscle, you can depress the head, or flex the head, and the chin drops. So, but this would be an example of a first class lever. A second class lever is a little bit different now. Okay, so in this case, the fulcrum is placed on the opposite side of the effort, and the load's put in the middle. And so a good example of this, if you've ever looked or worked with a wheelbarrow, where the fulcrum is going to be at one end, the effort is going to be at the opposite end, and the load is what's in the middle. Okay, so you pick up on one side, okay, to pick the load up, or if you put the load down, or bring the lever down on the other side, it brings the load down. A human body example here, the fulcrum would be the metatarsal phalangeal joints here. The load would be the weight of the tarsal bones, the calcaneus, and the effort would be the contraction of the gastrocnemius, or the soleus muscles. Okay, and this gives you a nice example of a second class lever. Okay, and this is all relative too. Okay, you can apply these levers. You can apply these levers in different ways. A third class lever here is going to be kind of the opposite, where the load and the fulcrum are on the opposite ends, and the effort is going to be in the middle. Okay, and so if you've ever used a shovel, okay, this is a good example of a third class lever. In this case, you can see the load, in terms of the biceps brachii here, or in which the fulcrum is the elbow joint, the effort is the muscle, that biceps brachii, and the load is the weight being held by the hand. And so this is an example of a third class lever. And if you increase the effort, you raise the load upwards. If you decrease the lever, the load is going to drop. So, but these are the different class levers, and it's all about what you use the fulcrum on. Okay, and I'm not gonna ask you anything about, here's a joint and apply, the fulcrum, effort, or load. I just want you all to know the first, second, and third class levers on the body. All right, mechanical advantage and disadvantage. Okay, now before I start talking about these, I need to make this disclaimer. Okay, mechanical advantage, mechanical disadvantage. One is not better than the other. Okay, and what I mean by that is that this is just the terminology that is used to describe what is, kind of what you're doing in terms of manipulation around a particular joint. Okay, mechanical advantage, it has to do more with being slower and using less effort, whereas mechanical disadvantage is you have to use more effort to move an object, but you gain a lot more speed and mobility by doing it. So it's not that one's better than the other. They're two different methods of assessing joints. All right, and so here you can see kind of advantages and disadvantages here. Mechanical advantage. You can see the lever, the stick here is in the fulcrum. This is a first class lever. All right, we have a lot more leverage to get the brick up in this top part. However, in this case here, the mechanical disadvantage, we can joggle the brick a little bit easier, meaning we can go a little bit faster with the brick, maybe up and down, because the lever is stretched out a little bit more. Okay, so these are good examples of mechanical advantage and disadvantage. Now, how do we apply this to the human body? So, with the human body, we have to get further away from the joint, and mechanical advantage. So in this case, the knee joint, right? And so mechanical advantage is slower. Okay, you're assessing the joint through its full range of motion, and you're further away from it. Versus mechanical disadvantages, you're closer to the joint, and you're able to assess the joint. You have to use a lot more force, yes, but as a result, you're able to utilize a little bit. It can be a little bit more faster. You can manipulate the joint a little bit easier. All right. Now, with the joints, it's really an important concept here that you want to balance the musculature around a particular joint as a massage therapist. Okay, if you can't do that, then the patient client is always going to still have problems here. Okay, and so you may have seen this particular chart before, the postural analysis, in which you can visualize where the shoulders are, where the hips are, and where the where the pelvis, knees, and ankles are located. And if any of those are kind of off kilter, then that's going to affect the musculature. So being able to really see, in looking at your client, do they have some sort of tilt to the side? Do they hunch over? Do they have some lordosis? Okay, these are all things you need to take into consideration when you're doing your intake, and even after, when you're starting to work on your client. Do you need to make any other notes of what's going on? So biomechanics really functions really well and operates with these different reflexes, okay? And so there's many different pathways to do something with the body, okay? And I'm going to talk about what's scratch, what itches, okay, in a little bit, because that relates to the functional aspects here. And then we have an integratable functional unit, in which we have the inner unit, which is the postural or the stabilizer muscles, basically your core muscles. And then you have your outer units, which are more appendicular muscles, mover, phasic type muscles. So let's scratch what itches. So a long time ago, when they were first learning about how the nervous system integrated with the muscular system, they did some pretty interesting experiments. Okay, and so what they would do is they take a little cotton gauze and place it onto a frog's arm. Okay, and so the frog, of course, it would irritate the frog's skin, and of course the frog would try to, get it off. And so what you'll notice here in this particular picture, the frog, this is mapping out its going from its foot in a circular pattern in A. This is how the frog is moving its foot to scratch what itches, basically. Itches, or it hurts. And so this is in relation to the upper limb here, in this particular position above the head. However, when they move the arm downward into a different position, now this changed the kinetic chain, okay? And so other muscles had to be utilized to accomplish the same goal. And so in this case, the frog would bring the foot upwards and then downwards, and kind of in a nice counterclockwise motion than it was in the original one when the arm was up. So these reflexes, the way these reflexes are hooked up, it's in a very complex way depending on the other limbs. Okay, and that's what these kinetic chain patterns are there for. It's all about how the other limbs are positioned that you're going to be able to do a certain behavioral type of movement. And so this is especially important in terms of the inner units, or the intrinsic muscles. Okay, these are the joint stabilizers. And so most of these muscles are going to have attachments to the axial skeleton. So like your erector spinae, your multifidus, your abdominal muscles, diaphragm, pelvic floor muscles. These are all joint stabilizers. This keeps the trunk kind of stabilized. All right, and so here you can see the semispinalis and splenius muscles in the head, as well as the erector spinae muscles, the spinalis, longissimus, and iliocostalis. These help to make sure that the trunk isn't moving any which way. Right? There has to be some sort of anchoring force or stabilizing force to be able to allow those appendicular muscles in the lower extremity as well as the upper extremity to move properly. Okay, so spinalis, longissimus, iliocostalis there. Okay, and also multifidus. Now that multifidus, this is the real main one for the deep back muscles, and also the transverse abdominal muscles. The transverse abs, multifidus, and psoas major muscle. Those are your core muscles right there for that low back area. Okay, the abdominal walls, the external oblique, the internal oblique if we go deep to the external, and then of course rectus abdominis there, and transversus abdominis. And I'm not going to get into too much detail with the muscles. I'm not going to ask you the muscles here, okay? But I do want you to be aware that these muscles do make up the inner units, okay? Basically the trunk musculature. If we're talking about trunk musculature, this is them, okay? Also the diaphragm. The diaphragm has a very interesting attachment site. It's going to attach to the lumbar vertebrae. And if somebody does have low back pain or a slightly herniated disc, actually deep breathing can help them, because it can put some tension onto the actual vertebrae there and help with core stabilization. Now in the pelvic area, this is the male perineal region, which we don't get into and everything. This helps to stabilize the inferior parts of the trunk. Okay, Kegel exercises for women, and here we have the same type of muscles here, and for the women, the urogenital diaphragm, the pelvic diaphragm. These are muscles when they're contracted. This helps to stabilize the trunk. Okay, this is why those Kegel exercises are really useful, are really helpful during childbirth, because you're stabilizing the trunk. And so those inner units are extremely important. And if there's weakness or instability in those inner units, then you're going to have problems with these outer units. The outer units, you're not going to be able to stabilize. You have to have something that anchors you in place. And so the outer units are more of these superficial muscles. This is really the parts where you can get to on the extremities in your massage therapy practice. All right? So as you're doing these, or as you're looking at the kind of this inner and outer unit, one of the things you really want to assess in terms of the biomechanics are a few general features. And you can actually do this as you are talking or walking with your client. Okay? And so first things is posture. Okay. You observe, is the client's back straight? Is the client's hips rotated anteriorly, laterally, or more outwardly flared on one side? Okay, why would that be important? And we're going to look at that. All right, sitting, standing, and bending. Okay, is the client leaning forward, slouching, or erect? What's the range of motion when bending at the waist or other joints? Okay, you can ask a patient, hey, can you bend over, or can you squat? Okay, those sort of things are important. It tells you a lot about the tone of their musculature. Walking and gait. This is going to be an extremely important one that you want to pay attention to. Okay, is there a natural swing of the arms, contralateral to leg movement? Okay, as the left arm comes up, the right leg is going to come up at the same time, and vice versa as your gait goes. Does the client favor one side? Does the client's center of gravity rise and fall when walking? These are all questions you should ask yourself, and things that you can observe without having to even ask them a question. You need to be observant. You need to pay attention. All right, and so that posture, the biggest thing with the posture is the vertebral column. So that vertebral column, if it deviates in any way, shape, or form, it's going to give your client problems. Okay, it's supposed to have a nice S-shaped curve. If we look at laterally, S-shaped curve. We'll see a secondary curvature in the cervical region, a primary curvature in the thoracic region, and then a secondary curvature in the lordotic region, primary curvature in the sacrum and coccyx. Now, these curvatures are they come about as a human being is growing. So from childbirth, and I want y'all to think about this, all right? From childbirth, as the baby starts to move around and get on its own, one of the first things that happens is the baby lifts up its head. It lifts up its head, and you get that secondary curvature in the cervical region. The next thing, as it continues to grow, it starts to pull itself up onto like the coffee table or chair, and then they start having that secondary curvature. And so this S-shaped curve is extremely important, and it's developmentally there, due to the different changes that the human beings go through. Also, you'll notice that the vertebral column is straight in terms of its medial and lateral arrangement. We don't want a lateral deviation of that spine. That's scoliosis. We can also get pelvic tilt, which can affect the positioning of the vertebral column. And so you'll notice in that neutral position in A, that's how it should be. However, if the pelvis rotates anteriorly or posteriorly, that can indicate some sort of muscle imbalance between the anterior and posterior musculature. Same thing with the anterior-posterior axis in terms of pelvic tilt. Okay, if one hip is higher than the other, that can indicate some sort of muscle imbalance. It could also be that someone's leg might be shorter than the other. Okay, that could very well be a structural problem with the bones. It doesn't necessarily mean it's structural. A lot of times, even if it is structural, the client's going to have problems with the musculature, which is something that we can address as massage therapists. You'll see a lot of guarding of muscle here. Also, kind of the vertical axis, is one of the crests of the ilium. Is it flaring out? All right, which can happen. Okay, and it can cause some discomfort and some pain there. All right, and so this is just, again, showing you the some of the things that can happen with the vertebral column. Everything hangs off the spine. If for some reason there's problems with the vertebral column, you're going to get muscle imbalance here. Now, in the case of lordosis here, what can happen, and you can definitely attest to this with women who are pregnant, is that erector spinae muscles tend to get bunched up back here and contracted. But guess what ends up getting more stretched out and elongated here? Like psoas major muscle, the rectus, the rectus abdominis muscles here anteriorly. Same thing back here with the kyphosis. Now this is a extreme version of kyphosis, but the back muscles can get stretched out, whereas the muscles like pectoralis major and minor can be more contracted. And then if you've got scoliosis, well, one side can be stretched out versus the other side can be contracted. All right, so you can see there again, kind of highlighted that the back muscles tend to be more tight, contracted, whereas the abdominal muscles, the psoas major, can be a little bit more elongated or stretched. Okay, flexor muscles of the hip can be more contracted or tight. Extensor muscles of the thigh more elongated and stretched. Okay, and I don't want you to memorize this particular table here, but this is just some of the things that can happen when when there's different types of rotations involved with the pelvis here. All right, now what I just described for you is kind of that lower cross syndrome, okay, in which you can get tightness. So that's why I say that the erector spinae and the psoas major muscle, they tend to be tightly intertwined. So if somebody comes in with back pain, you can rest assured that iliopsoas is also going to be involved, and vice versa. Okay, and then also the gluteus maximus and abdominal area is going to be kind of weak. All right, can you have it the other way around? You can, but more commonly it's like this. Tight erectors, tight iliopsoas. 9 out of 10 patients that I've seen, it's been like that. You go for the horse. You don't go for the unicorn. Okay, the unicorn just doesn't exist. All right. You can also have what's called upper cross syndrome here, in which you get tightened pectoralis major muscles here. Okay, and then you can also have kind of tightened upper traps. Now, what's happening here? We also have some weak rhomboids, lower trapezius. So what's happening here, especially with the trapezius? All right. Over time, if somebody is, kyphotic and they're leaning over, and let's say you're leaning over your screen right now, or looking at your PC monitor at home. What happens? Why the upper traps will get tight is not necessarily something associated with, the muscle actually contracting. What's happening is that the muscle is being stretched. The muscle gets stretched. And as a result of it being stretched, it gets to a point where the muscle, the nervous system will protect it, meaning it will stimulate it'll stimulate the muscle to contract, to protect it. Otherwise, the muscle will pull apart away from its actin and myosin filaments, so which we don't want. And if this happens over a long period of time, like somebody doesn't do self-care, somebody's constantly at a computer desk all day long, 8 hours a day, 7 days a week, then that over the period of a year, 2 years, 3 years, 5 years, by the time they're up in their 50s or 60s, they have a hunchback, and so the muscle just hasn't been worked. All right, sitting, standing, bending. So the weight needs to be distributed from the bottom of the foot, from squatting, sitting, standing. Otherwise, the instability in the ankle joint ensues. Ideally, you should be able to squat. Have a full squat and keep your feet flat on the ground. If you can't do that, then there's muscle imbalance. If you have to come up on your tippy toes, there's a muscle imbalance when you squat. And this gets to the walking, all right? And what I want you to notice about the, don't worry so much about the heel strike, flat foot, mid stance, but what I want you to do is notice the hand and the leg placement. So notice that in this first picture here, the left hand is forward and the right leg is forward. And then as you walk down the line here, now with the next gait here, the right hand and the left leg are forward. And then we continue along in the gait, and now we're back to the kind of where the heel strike is here. And so this is an important concept in understanding this is the normal gait. So with the kinetic chain protocols, okay, and we're really going to focus in on the gait, okay, as well as some of the abductors, adductors, but the main thing I want you all to understand, and you want to walk around when you're looking at this, okay, is that the right arm flexors are going to concentrically contract with the left leg flexors, and the left arm flexors are going to concentrically contract with the right leg flexors. All right? If you don't understand that, walk around a little bit and think about it, okay? The same thing goes with the extensors. The left arm extensors are going to concentrically contract with the right leg extensors. And then of course the right arm extensors are going to concentrically contract with the left leg extensors. And so the best way to do this is just take a stroll, walk, all right? And you'll see it. You'll see the gait, how it's supposed to go. Lead with your left hand, lead with your left hand, your right leg will follow. All right? And so why do we do this? Okay, so this gets right into the kind of the biomechanics part of the protocol here. And we need to capitalize on this, all right? So in this case, as you can see from this particular picture here, the right leg flexor here is going to be going with the right arm flexor. Okay, so you control roughly about 10 to 20% of opposing pressure on the leg here, and then you ask the client, go ahead and push up against my hand against resistance here. And there should be, it should be strong, okay? Because these two motions are connected neurologically. So that means that as you're walking, this is something that is connected neurologically, where both of those particular muscle groups have to contract at the same time to produce a certain behavioral movement. In this case, taking a step forward while at the same time balancing the limbs. And so they should be strong together. So contralateral flexors. Now, the extensors should be a little bit weak. So that means when you control for the flexor here, the extensor, it should be a little bit less in terms of its strength. All right, and again, it goes back to this cross extensor reflex, okay? Meaning that if you are causing flexion of the hip, here, that means that the flexors on the opposite side have to be relaxed. Okay? But also, this also works well with the arms. So the flexor of the right leg is going to be neurologically hooked up at the level of the spinal cord with the left flexor, the left arm flexor. All right. Now, what we're going to do in the next session with the biomechanics is we're going to do a series of tests, but you can actually test this out on your own, in which the left and right arm flexor tests, where you control the hip flexors, and then you check to see if the contralateral arm is strong. Okay, now if it is strong, it should be strong, and understand that the strength is relative to your client. It's relative to your client. It should be able to resist your strength at this point here. All right. Same thing if in terms of the leg flexor test, contralateral leg flexor test, where instead of controlling the leg, now you are going to control the arm. So you control the arm, and then you test the leg flexor and then the leg extensor. Okay, and then vice versa, you can do the left or right arm extensor test, and of course the right or left leg extensor test. Okay, and then basically here, the composite for the contralateral test. So if A and A should be strong together, B and B should be strong together, but if you mixed B and the B of here on the upper extremity flexor with the extensor on the leg, it'll be weak, or it'll inhibit. This is also a good way, if somebody has really tight muscles, it's also a good way to help get those muscles to relax. Okay. You also have ipsilateral extremity test here too, and it's quite the opposite. So instead of looking at the contralateral flexor here on the right side, you go for the ipsilateral extensor as the control, and then you check for the flexor on the same side on the upper extremity. So left and right arm flexor test. You can also do the right or left leg flexor test here, where you're controlling the extensors here and checking for the strength of the flexors and how the extensors respond. And the same thing goes for the extensor test. You control the same side flexors, and then you test the same side extenders. And of course, vice versa with the leg. Control the upper extremity flexors, and then test for the lower extremity extensors. And basically, this is how it is again. The extensors and the flexors on the same side should be strong. The flexor in the upper extremity and the extender in the lower extremity should be strong. If you look at both the B or A, it's going to be kind of weak and inhibit. Right? You can even test for the adductor abductor test, in which you hold the kind of an isometric contraction either on the hips, and test the arms, or you isolate the hips or isolate the arms and test for the hips. Okay, and of course there's different types of joints associated with this, and I'm not going to get into all like the different types of joints and whatnot, but these are complex movements with the biomechanics, and so you should be kind of aware of the the different muscles associated with the joint movements. I'm not going to ask you the actual muscles, but you should be aware of how the biomechanics with the gait operate here. Okay, and then we'll follow this up with the kind of a Zoom session, so you'll be able to see this a little bit more.